This is the video animation of the FDA-cleared laser periodontal procedure called Laser-Assisted New Attachment Procedure, or LANAP. The periolace fiber, about the size of 3 human hairs, is gently placed between the gum and teeth to remove the diseased tissue inside the pocket. This laser fiber selectively removes the diseased tissue and kills the germs that cause gum infections, while leaving healthy tissue unharmed. This also improves access and visibility for better removal of the barnacles of calculus from the surface of the teeth. Tiny ultrasonic root cleaners vibrate these deposits away and flush them out with antibacterial rinse. Once the surfaces of the teeth are clean, the laser is used a second time at the bottom of the pocket to remove any remaining debris and to sterilize the pocket, soft tissue, root, and bone. This also causes the blood to become sticky, creating a seal around the teeth. Once the seal is formed, we have created a clean, closed, and stable environment for healing to begin. We have tipped the scales in favor of regeneration versus degeneration.